The health-related steps that have been taken are shown in this slide. 15,000 crores was declared by the Prime Minister as released, and from that 4,113 crores have been released to the states. Essential items of 3,750 crores were bought. Testing labs and kits were also brought in. Insurance cover, which is the most important thing there, insurance cover of 50 lakhs per person for health professionals under Pradhan Mantri Garib Kalyan Yojana was announced. Also making sure that telemedicine comes into play. There was a rollout of e-Sanjeevani, which is a teleconsultation service, and capacity building exercises have also been taken up through virtual learning modules. Then protection of health care workers required an amendment in the Epidemic Diseases Act, which is a fairly an old act, but amendments have been made. And one thing which the Prime Minister mentioned during his speech, which is worth recollecting, that this challenge gave us an opportunity to prove to the world that we can ramp up production of protection equipments. Today, we have more than 300 domestic manufacturers of PPE, and early when this whole epidemic came into existence and all of us really got ourselves to take preventive steps, there were not even one producer of PPE. Already we have supplied about 51 lakhs of PPEs, 87 lakhs of N95 masks, and also 11.08 crores of hydroxychloroquine tablets. Health reforms and initiatives have been put in place. Public expenditure on health will be certainly increased. Investments at the grassroots level will be ramped up for health and wellness centers, both in the rural and urban areas. Remember that we had been talking about wellness centers so that they can be in tier 2 and tier 3 cities, and particularly giving focus in aspirational districts. We also spoke about the viability gap funding for the social infrastructure only yesterday. So we will be ramping up all the wellness centers and health infrastructure. All districts will have an infectious diseases block in their hospitals. All districts. Then lab in Delhi, we have a lot of path labs moving around and which facilitates people's lives. Lab networks in rural areas are not adequate. So public health labs will be set up at all block levels, not just in district, but block levels. We will have public health labs. So I recall Prime Minister did say this pandemic is a challenge. This or any pandemic, if at all it poses a challenge, we need to be ready, Atma Nirbhar, in hospitals, at the block and at the district levels. So there is a lot of emphasis being now given for setting up hospitals and also labs, diagnostic labs and testing labs, both with private and public funded opportunities.